Assalamu alaikum viewers, hope you are doing well. Today I am your host, Hakim and Dr. Abdul Moiz Tariq Taseer. Today I will explain about the disease male infertility, its causes, its symptoms and way of treatment that Taseer Dawakhana is offering to cure this disease from a course which name is Taseer Almas Kasturi Sperm Therapy. Viewers, first of all, we should know that what is infertility. Infertility is defined as not being able to get pregnant despite having frequent unprotected sex for at least a year. If getting pregnant has been a challenge for you and your partner, you are not alone. 10% to 15% of couples in the world are infertile, and there are several hormones which affect a person for producing a child like testosterone, LH and FSH hormone. In general, the normal range in males in about 270 till 1070 milligram with an average level of 679 Ng. A normal male testosterone level peaks at about age of 20 and then it slowly decreases. Testosterone level above or below the normal range are considered by many to be out of balance. LH luteinizing hormone is a hormone produced by gonadotropic cells in the anterior pituitary gland in male, where LH had also been called as interstitial cell stimulating hormone. It stimulates Leydig cells production of testosterone for male. The normal range is 1.24 till 7.8 L. If LH level are below the normal range, it may indicate a pituitary gland problem. Their pituitary gland may not be making enough LH, which may lead to low testosterone. Follicle stimulating hormone FSH is a gonadotropin, a glycoprotein polypeptide hormone. FSH is synthesized and secreted by the gonadotropic cells of the interior pituitary glands and regulates the development growth, partial masturbation and reproductive processes of the body. Normal FSH level in adults men are typically between 1.5 to 12.4 milligram. A high FSH level in male may be the testicles are not functioning correctly, while the low FSH in males may indicate problems with the pituitary glands in the brain. If you have been trying to conceive for more than a year, there is a chance that something may be interfering with your efforts to have a child. Infertility may be due to a single cause in either you or your partner, or a combination of factors that may prevent a pregnant form occurring or continuing. There are two types of infertility: primary infertility and secondary infertility. Primary infertility is the inability to conceive a child after regular intercourse for at least 1 year, while secondary infertility occurs in couples who are previously been pregnant at least once but are unable to conceive another pregnancy. As per medical research, in 50 to 60% infertility cases, male have infertility problem. A normal causes exist for male infertility that may result in impaired sperm count or mobility, or impaired ability to fertilize the egg. The most common cause of the male infertility includes abnormal sperm production of function, impaired delivery of sperm, condition related to a man's general health, lifestyle and overexposure to certain environmental elements. There are sub-conditions required for pregnancy. Good health is essential for both men and women. Male semen has normal sperm count. After every 72 hours, men should produce 1.5 to 5 milliliters semen. 50 to 60% of active motile. If a person is not meeting this given criteria that I have mentioned, then he is not able to produce a child or make a woman pregnant. When a normal person ejaculates, then he releases 200 to 600 millions of sperm. If he has 50 million or less than 50 million active sperms, then he is not able to produce a child. In mathematical expression, we have a formula: 200 divided by 75% is equal to 150 million active sperms. 200 divided by 70% is equal to 140. 200 divided by 60% is equal to 150 active sperms. Viewers, a man produces 50,000 sperms in a minute, 72 million in a day. These sperms get mature in 84 days. Fertile may be occur because of different sperm diseases. Viewers, semen produced in testicles. Testicles are very important in sperm production. If testicles are not working well, then it makes a problem. There are two types of testicle disease. First one is hydrocele. A hydrocele is a type of swelling in the scrotum that occurs when fluid collects in the thin layer surrounding a testicle. Hydrocele is a common in newborn and usually disappear without treatment by age 1. Older boys and adult men can develop a hydrocele due to inflammation or injury within the scrotum. And the second is varicocele. A varicocele is an enlargement of veins within the loose bag of skin that holds your testicle. A varicocele is similar to varicocele vein you might see in your leg. Varicoceles are a common cause of low sperm production and decreased sperm quality, which can cause infertility. There are three types of sperm diseases named azoospermia, oligospermia, and necrospermia. Now I will tell you a little bit about azoospermia. Viewers, azoospermia is a medical condition of a man whose semen contains no sperm. This is associated with infertility, but many forms are unable to medical treatment. Azoospermia main cause is infection, it includes pus cell in semen, blood in semen, or presence of bacteria. This condition does not have any symptoms. Second type is oligospermia, male infertility issue characterized by a low sperm count. Other aspects of the sexual health of men with this condition are typical. This includes the ability to get and maintain an erection, as well as produce ejaculation at organism. Sperm count in your ejaculate can vary throughout your life. As I explained, normal sperm count is between 200 to 600 million. So if a person has less than 120 million sperm count, then he has oligospermia. This disease is because infection of vein, physical disturbance, anxiety, and abnormal hormonal level. Now I will tell you about the infertility disease, that is necrospermia. Necrospermia is a condition in which there is a low percentage of life and very much percentage of immotile spermatozoa in semen. It can be diagnosed via semen analysis with vitality staining performed to determine whether the sperm are dead or alive and immotile. Because of men are unable to make a woman pregnant, Taseer Dawakhana has been established since 1946, and you can recover from all these diseases by using Taseer Almas Kasturi sperm grow course by Taseer Dawakhana, which is made with precious herbal and free from any side effect. Doctors and scientists of our institute Taseer Dawakhana worked under the supervision of Dr. and Hakim Tariq Mahmood Taseer. Qualified doctors, lady doctors, pharmacists, and Hakims with prolonged research. Taseer Almas Kasturi sperm grow course is a chemical-free natural supplement with no side effect. It is prepared from pure herbal and 100% effective. Taseer Almas Kasturi sperm grow therapy is prepared under the medical principle and proper scientific method with up-to-date machinery in Taseer Laboratories. Taseer Almas Kasturi sperm grow therapy cures azoospermia, oligospermia, necrospermia, varicocele, hydrocele, pus cells, infection, hormonal level, maintain pH level of a person, increase the volume of semen, thickness in semen, sperm morphology, every type of infection, and start producing sperm where person is be relieved from all infertility diseases. Increase HGH hormone level, FSH, follicle stimulating hormone, LH luteinizing hormone, and normalize the sperm count of infertile men so they become fertile. Taseer Almas Kasturi sperm growth therapy is made with special, precious, and rare herbs. It consists of 12 precious herbal ingredients, so it provides some extra benefits. Taseer Almas Kasturi sperm growth therapy is made with unique formulation, contains safe, natural ingredients which are known to increase sexual desire, sexual stamina, and self-confidence by increasing peripheral blood flow because the ingredient in Taseer Almas Kasturi sperm growth therapy with highest quality and verified purity. Their potency is much more effective, stable, predictable, and efficient. As it is multi-purpose course, so it also boosts the sexual power of a person and improves physical health. Taseer Almas Kasturi sperm growth therapy has our special herbal. Our quality is to achieve the gain of centimeters in penis length and especially the girth to help you get your confidence and sexual satisfying experience, which is especially prepared for those who has erectile dysfunction, ejaculation, duration problem, stiffness, length and weight problem with penis. It is very safe and easy to use and made with 100% pure herbal extracts. For better treatment, avoid sexual relation with partner during course, and medication avoid eating potatoes, beans, beef, and all spices and cold drinks. Use pumpkin, carrot, milk, butter, yogurt, fresh fruit, honey, dates, and fish. Don't put your laptop on your lap. It also affects your penis and makes you infertile. So avoid to do this thing. Quit smoking. Tobacco has multiple negative effects on your fertility, not to mention your general health and the health of a fetus. If you smoke and are considering pregnancy, quit now. Avoid alcohol. Heavy alcohol use may lead to decreased fertility. Alcohol use can affect the health of a development sperm. If you are planning to become father, avoid alcohol and don't drink alcohol. Reduce stress. Some studies have shown that couple experiences psychological stress had poorer results with infertility treatment. If you can find a way to reduce stress in your life, eliminate your infertility with Taseer Almas Kasturi sperm growth therapy and spend happy life with your complete family. So viewers, if you or your known person has infertility problem, then come to Taseer Dawakhana and use Taseer Almas Kasturi sperm growth therapy, which will cure all infertility diseases and problems. I hope this video was informative and helpful for you. If you like this video, kindly subscribe our YouTube channel and click on the bell icon. I will see you again in my next video, in which we will discuss new diseases topic and its treatment. So viewers, it's time to say goodbye. Have a nice day. Take care. Allah.